Televisa presenta.
Hi, my name is Gladys, and I am going to talk about the introduction of what is dentistry. Dentistry is one of the health sciences that is responsible for the diagnosis, treatment, and prevention of disease for the stomatognatic system, which includes, in addition to the teeth, gums, periodontal tissue, upper jaw, lower jaw, and temporomandibular jaw. The main diseases dealt with by dentistry are tooth decay, malocclusion, and periodontal disease. Specialty in dental operatory is when we do all the procedures all made to return functionality, integrity, and aesthetic structurally damage the teeth. It must be seen as a group of perfectly designed techniques with biological and mechanical principles that have lost their functionality to achieve the dental restoration. To achieve the dental restoration, we use resins, amalgams, crowns, inlays. We use two crowns and we use resins or amalgams for repairing to the functionality. The cavities are damaged areas on the surface of the teeth that become small of opening rolls contours occur due of the combination of factors that shows that bacteria in the mouth. The first recommendation for this situation is have an excellent oral hygiene. Don't eat a lot of sugar, don't smoke, and don't forget brush your teeth every day.
What is oral surgery? Oral surgery refers to any surgical procedures performed around your mouth and jaw, usually via dental specialists who's trained to perform certain acts of oral surgeries. Mm, what are some tips oral surgery? Some of the most common oral surgery um, implanted wisdom teeth, gum graft, tooth implants, maxillofacial surgery, root canals, jaw and teeth repairing following an injury. Some recommendation: don't smoke or drink cold. They can slow jaw healing process. If you are any pain from swelling, use an ice pack to reduce inflammation. Rather brushing your teeth, dries your mouth with slow water every few hours to kill of any bacteria. Avoid consuming anything through a straw and don't eat any crunchy of cherry food. Consume soft food such as yogurt, some food rich in protein such as eggs, uh, so fish, um, also fruit bitters. It is recommendation that the food eat at room temperature to avoid bleeding. Uh, at last, his soft diet should be followed the first 3 days. Mm, avoid resting the first 24 hours after surgery. It is more advisable to perform rinsing with salt water, moving the hair from one side to the other with hot, making some.
Hello, I am Osiris and my specialty is periodontology. A long time ago, a patient with tartar arrived. Tartar, sometimes called calculus or dental tartar, is the bacterial plague. It can also form on the edge of and under the gums and can irritate the gingival tissues. Tartar gives plaque a layer surface to adhere to leading to more serious conditions like tooth decay and gum tissues. To reduce tartar formation and reduce plaque, it is important to brush properly, especially with the tartar control toothpaste and floss. Once tartar has settled on your teeth, only your dentist or hygienist will be able to remove it. The process of removing tartar is called root scaling. During this process, the dentist or hygienist use special instruments to remove tartar that is visible on the teeth and that is below the gums line. My recommendation as your dentist is that you consume foods that don't generate dental calculus, salt or sugar, be it sweets, popsicles, etc. And visit your dentist less twice a year. In addition to having a correct brushing, use dental floss and mouthwash.
Hi, I am Joanna. My specialty is orthodontic. Oral health and nutrition during an orthodontic treatment have the objective of improving people's quality of life. A balanced diet manifests itself in good oral health, which is why the mouth is one of the first place where we can detect manifestation of poor nutrition. The nutritional status of a patient can affect orthodontic treatment, altering the moment of death and the retext of the tissues to the forces applied in treatment. Orthodontic favors the accumulation of buccal biofilm because the patient cannot carry out an optimal removal of the plaque when encountering physical impediments, when brushing, and the difficulty of performing the hygiene of the proximal areas. This increases the chance of the develop periodontal disease, gingivitis, or periodontitis. Mouth ulcers are very common due to the friction of orthodontic applets with soft tissues. These oral lesions are very annoying to the point that they can make it difficult or limit eating and in some cases also speech. One of the important recommendations is to apply orthodontic wax on the parts of the applets to cause the discomfort in the mouth. 1. Proper cleaning. 2. Using dental floss and mouthwash. And 3. Consultation with the dentist.
Hi, my name is Josue. Today I will tell a little about the specialty of endodontics. Endodontics is one specialty of dentistry. It's a commonly known dental treatment of killing the nerve. It consists of removing the dead part of the tooth when it is injured or infected. The objective of this treatment is to clean the inside of the tooth and fill with material. Endodontics is indicate where there is a very widespread decay or a dental fracture that causes inflammation of teeth and the dental pulp. Recommendations: will the anesthesia last? Avoid beating your lips and tongue. The effect of anesthesia will wear often 2-3 hours. About chewing gum, eating hard food or food that can adhere to the tooth. You can continue brushing your teeth normally. even in the treatment area. During the first days, by checking with the side of the month where the endodontics has been performed, this will ensure the final seal. Use dental floss as always, and when cleaning the treatment area. About pulling the thread up, always pull the thread laterally. Thank you.
Oral rehabilitation is the specialty of dentistry in charge of diagnostic patient dental problems and determine the treatment and must carry out the ration aesthetic of functionality. The main reasons which you might need oral rehabilitation are death with root canal treatment, tooth fracture, loss of teeth. My recommendation will be to have a good brushing technique to avoid tooth loss.
In conclusion, dentistry is very important for everyone and quite for its specialties that meets the needs of children to other adults.